is up, y'all? This is Not a Real Doc TPT. Thank you for coming back and join me for another video. So today we're going to pick up from where, well, didn't really leave off, but we're going to do the opposite of what we did for the last video topic, which is last time we covered what is good physical therapy. So I thought it would also be a good idea to go into talking more specifically what is bad physical therapy. I mean, obviously, it would be the opposite of what's considered good, but there's a little more to that I felt like could be expounded upon. So this video is going to be for folks that are currently getting physical therapy, and so that way you can have an idea of what does physical therapy look like when it's not going well. So first thing, so we're going to talk about with that. Well, one, and that I would say that's kind of an obvious one, which I just talked about, but probably the worst physical therapy is going to be the kind of physical therapy where you're not getting better. Therapy where the therapist is not able to progress you along and you're continuing to have the same issue that is not being corrected or being addressed. Now, that said, sometimes people are going to have some chronic key issues that are going to make them sometimes frequent flyers with your clinic and coming in a lot to kind of work on things. If a condition has been there for quite some time, it's going to take a little while. It's not going to instantly get fixed a lot of times. So it's not unexpected that a patient may make slow progress, but they still should feel like they're progressing. They should still feel like they are working towards their goal and they are getting better. If they're not, that would be, and the therapist just keeps doing the same thing over and over again and is not really addressing the fact that you're not progressing. That's probably the worst physical therapy. So, this leads also to another topic. I keep coming up with all these different ideas for new physical therapy topics for us to talk about on these videos. But that also kind of leads me, and taking a slight detour here. Being a bad patient also should be addressed. If you're not making progress, if you don't feel like your goals are being addressed, if you don't feel like you are being heard by your therapist or the therapy team that's working with you, you need to speak up and say something about that. Don't just passively go through the process and allow yourself to spend all this money from your insurance and then get 3 months, 6 months down the road without having accomplished your goals, without having had significant improvement. So speak up, say something, be a part of the process. So that's, yeah, but so I'm gonna do a whole video topic on that. That deserves its own set of discussion. So I'll table that. There's a lot more that can be said about that right there, though. All right. So another example of what would be bad physical therapy, and I haven't really numbered these because I think I could also go for quite a while. But bad physical therapy would be when you're treated like a number. So if you do not feel that when you come in that there's a good rapport that your therapist has, if you're just kind of treated as just another body, you're just another patient for them to see. That's not good physical therapy. That's kind of bad physical therapy. You should never feel like you're just another number that's being treated. Really, ever. That's bad physical therapy. Say something about that. If that's what you're experiencing. So, and I'm gonna be careful about this. I'm not saying any names or anything, but there is a particular practice that is near where I reside and practice that is notorious for patients walking in and they're basically talked to by the therapist or by the PTA, whoever the lead or the person that's the lead for that day on the therapy team is, and they are then given a set of exercises on a sheet of paper, like given, might be front and back, might be multiple, might be 2 or 3 pages, and told, okay, here's your therapy for today. Now go ahead and start this, and I'll, see you later. And so then they will do their exercises, the patient will, and then they'll come back, and then the therapist will say, okay, we'll see you next time. Um, that is bad physical therapy. That is not good physical therapy. It's borderline not skilled physical therapy, which means it's borderline, well, it's borderline people could get in trouble for that. I would expect, but I'm not going to say names or get into any of that. But I'm just going to say you as a patient should be aware that if that's what your physical therapy is entailing, that's not good physical therapy. Your physical therapy should be the physical therapy care that you're receiving each time you go into the clinic should be individualized to you and to whatever your issue is that you're working on, and should be addressing what your goals are and where you're. It should all be individually or be individualized for you. In addition, as I said in the what's good physical therapy, the vast majority of patients are going into an outpatient clinic. They need manual therapy. If you're just doing exercises, and that's all you're doing, and they're not actually the therapist is not actually working close enough with you to then put their hands on you to try to help things move and slide, and make that better. Um, you're only doing about 50. You're only getting for your physical therapy about 50% of the playbook that we have to help to address a host of multiple issues, as therapists. So yeah, that's bad physical therapy. If that's being done with you, and you're going to a place like that, I would highly recommend that you find another clinic. Usually those types of places, and I should say this, let me do come back before I totally throw that clinic under the bus. Um, I should say there could be a time and place a little bit for that. That is a little bit more of a necessity when you're a high volume clinic and you're seeing lots of patients that fall into the same type. Like, so let's say that you're working for, like maybe an orthopedic clinic, and so you see tons of knees from one particular surgeon, and that particular surgeon wants you to follow a specific protocol. So for those types of patients, yes, they need to have that applied to them individually. That's where the art of this comes in. But I could see where you would have a clinic kind of modeled on, okay, we're a high volume clinic, and this is how we're kind of delivering care, and we are advancing you individually, but it's we're using this, um, this protocol. We're using paper exercises, things like that, to kind of help to deliver that. Um, Again, going back to the very first thing as to what's a bad physical therapy, as if you're making progress, and if you feel like you're getting enough individualized attention in that, um, then there's a chance that that could be beneficial for you. I would say that's going to be mainly for post-surgical patients, mainly orthopedic post-surgical. However, if you're a patient and you're saying, hey, my hip is hurting and I'm not sure why, it's not so much maybe arthritis, maybe, but there's something else. Maybe you're having balance issues. Those are things that would not be best addressed by a clinic that's a high volume clinic that's just going to hand out paper exercises for you. Um, I'll put that kind of asterisk or caveat to what I said. But in general, it's not good physical therapy. So this is also kind of an opposite. The next one that I have, to what I talked about as far as good physical therapy goes. But if your therapist is talking on the phone while they're working with you, if they're texting, like, that should absolutely not be done. That's happened a time or two with some PTAs that I've had work with me, that I've had to say something to them about. They you can't be distracted. Now, also, let me say, it's one thing to, hey, I got a quick text from my wife or my friend or something like that, and I'm kind of quickly taking my phone out, typing something in for 10 seconds and then I'm going back to do my job. That's not what I'm talking about. I'm talking about there's a whole communication thing going and they're paying more attention to their phone than they are to you as the patient. That same thing can apply to laptops and tablets that the therapist is using to do your note. And I'm throwing a lot of people under the bus here, and that's including me at times. I try not to, and we all do, but things happen. But if your therapist has their head buried into their laptop, working on the note while they're um, working with you, and they're more concerned and more attentive to their laptop or their tablet and that note that they're writing than they are to you and to what you're doing. Um, that's not good physical therapy. That's bad physical therapy, and that shouldn't be done. All right. This also, I would say, and I mentioned this in the good physical therapist, but therapy, but or the opposite of this, if you're seeing a physical therapist and they're seeing a ton of patients at the same time as they're seeing you, like you're number 4 or 5 that they're working with at the same time, that is too many. You're going to have bad physical therapy. And as I say, I am throwing myself under the bus here. Occasionally that happens. Like you may have a patient that showed up late. You have another patient showing up early. You have a patient who was on time. You were finishing up with another patient that was already there, and all of a sudden it's a cluster. And you want to try to help people. You don't want to have them wait in the waiting room very long. So you want to kind of keep things rolling. That occasionally things like that happen, and a seasoned physical therapist can, it's ugly, but they can get through it. But if that's happening every single time you go there, the therapists are constantly getting overloaded. You're going to be getting bad physical therapy because that therapist does not have time to individualize their care for you. They don't have time to consider sufficiently, I would say, uh, you know, all the different things that you might need. Like they might have to bail on doing manual therapy with you, because to do manual therapy with you, they'll never be able to manage what's happening with the other patients at the same time. That's bad. You should not go to a clinic that's having that happen over and over and over again. Occasionally things happen. Just we ask, the more understanding you can be for that type of thing, is very much appreciated. But it should not be the norm. If it's the norm, find another clinic. Um, if you were okay, so if you are not receiving any manual therapy and you sought out physical therapy for pain with movement of some joint, some body part, or just overall yourself, like just when I move, I hurt. If that's all happened and you are not receiving any manual therapy, um, that's going to be bad physical therapy. If you're only treated with exercises with that, I that's not good. There are, again, depending on the different settings that you're in, I'm primarily talking about outpatient patients now for that. We might have a similar type of presentation from a patient in a home health setting, or you might have the similar thing in skilled nursing. In skilled nursing and home health, you're going to be much less likely to do manual therapy in those settings. So I'm not so much talking about those types of patients. Occasionally we'll do manual therapy on those, but more and more insurance is cutting down the number of visits. And if you can't see a patient more than like once a week, manual therapy is going to be, it's going to be hard to make a lot of progress with manual therapy. But in an outpatient setting where you're able to see that patient 2 or 3 times a week, and it's easier to see, or easier to follow that patient over time and the progress they're making. You, as I say, about probably 75% of all outpatient patients would be benefited by some form of manual therapy. Manual therapy is a big umbrella. There's a lot of different things that can be done. So I'm not really necessarily getting yet into anything as far as what's best, as far as I've got my own opinions on that, but that's for a different video. But just you need to be touched somehow, some way uh, at during your physical therapy session. If not every single session, at least maybe every other or every third session. Really, every third might be not quite enough, but about the earlier you are in the treatment, you would want to have more therapy or more manual therapy, and the farther along, or the longer that you're in the clinic or working over time, so you get down several weeks, then you're going to get less manual therapy at that point. But it should certainly, most patients that are in the outpatient setting should be starting with that. Otherwise, I would consider it bad physical therapy. All right. Oh, one thing. So if you're so sometimes an outpatient, you may have a workers' comp patient come in. So for those patients, what a physical therapist should be doing is individualizing the care for that patient and breaking down, okay, what does your job entail? What do you have to do? And so then me as the therapist, I'm going to try to think of, okay, what are the steps that I can break down and have this person go through, work on strength, the strength of doing something, work on speed, work on the neuro aspect of the rehab, to progress them to get them back to their job. If so, that's what you want to do, I would say, to effectively work with that patient. If um, you're working in that workers' comp type setting like that, and they are treating your rehab more generalized, and so we're just putting you on a bike, and then we're having you do some strengthening of your legs over here, we're strengthening your arms over here, and you never are actually doing anything that's related to your job. um, that's not good physical therapy. You should say something about that or go to a different clinic. So you want to have your care individualized to you. If you don't, um, it's bad physical therapy. I mentioned that for workers' comp, but really that applies to all patients. If you don't feel that you're getting individualized care, doesn't really matter the setting. That is addressing what your issues are, trying to address your goal, trying to do progress you with that. Um, that's not that's not good physical therapy, and you don't want to be a part of it. All right. Oh, this is one that's a little more specific to the home health environment. Um, Showing up unannounced and expecting patients to work with you, that would be considered bad physical therapy. If you're in the home health setting and you're receiving any physical therapy care, the therapist should be calling you really the night before. Sometimes it can be the same day because they'll have holes appear in their schedule, and so then they're expected to call other patients to see can you fill that hole in that schedule. So occasionally you might get same day phone calls, but you should never have a therapist actually show up to your house and unannounced and unplanned and expect you to work with them in physical therapy. That is bad physical therapy, and that shouldn't be done. They should contact you in advance. Usually and preferably, it's best practice would be the night before, but things happen. So sometimes it could be the same day, but it still should be at least addressed before they just arrive and expect you to drop everything and to work with them. That would not be good physical therapy. Now, let me put an asterisk beside that. If you are not answering the phone from when these therapists are calling you to try to schedule, it is their job that they have to show up eventually. Like it could be a day or two, and they might keep trying to reach you, but at some point, they're going to drop by to say, hey, are you okay? Has something happened? Have you gone to the hospital? So there are times when in home health, a patient or a therapist may show up unannounced to your house, but the only time that should be really acceptable and part of good physical therapy care would be if they cannot get a hold of you by any other means. They're calling your contacts, they're texting, they're they're calling all the numbers that are in the chart, and they can't get a hold of anybody. Yeah, that's going to lead to them dropping by your house. They might not expect you to work with them immediately on that drop by. They might come by just as then they can schedule with you in the future. But yeah, that's bad physical therapy. That shouldn't be happening if they're just dropping by. And I would refuse that and tell them, hey, no, you gotta call me again and plan. If they're just showing up unannounced and they haven't called or done anything. All right, so that's another example of bad physical therapy. Um, so another thing, and probably the one of the last things I think that I kind of thought of that would be considered bad physical therapy, and I think that would be a therapist that doesn't have a good appreciation for um, the progression of a patient through um, through their therapy care. So uh, how a person comes in to start with is not necessarily how that same condition is going to appear as they progress through your care. So you want to have a therapist that is going to apply the appropriate um, training, the appropriate exercises, the appropriate manual therapy, the appropriate treatments at the appropriate intensity over time. So it can't be just the same thing done every single time you come in at the same intensity, the same level of treatment, whether it's doing the exact same thing manually every single time. That all is that needs to change as you improve. So your care, like normally, you come in with let's say plantar fasciitis or something like that. We're going to be more heavy on the manual therapy initially, trying to do myofascial work, trying to break up that scar tissue, that fibrosis that can develop from the inflammation in your foot. Then as we do that, we'll be applying some exercises, but not quite as much exercise. Then as you continue to get better, then we're going to pull back on that manual therapy, maybe not do as much myofascial work, maybe do more passive range of motion type of things, but then start going heavier in the exercise. And then by the time we get to the end of your therapy care, we're going to be 100% doing exercises with you to help you now strengthen your way out of that condition. So your therapy care is going to change over time and progress with you. If your therapy care is not, you're getting the same cookie cutter stuff every time you come in, um, and it doesn't really adapt and grow with you over time, that's bad physical therapy. And you should change therapists, or certainly you should talk to them about it to find out why they're doing what they're doing. Um, Also, one other thing, I said that was the last thing, but I've again under promising, over delivering. Uh, another thing would be if you go in and you are receiving therapy care that is heavy on the modalities. So modalities are things like ice, is things like TENS units, heat. There are times, and there's therapy that I have seen when a patient may come in and they receive primarily and only like TENS units and heat and stuff for, let's say, like a back pain or something like that. Um, that's not good. There are time and a place. So let me add that in. Like I've had before, like a motor vehicle accident. They're the ones that are kind of notorious for this. When they come in to your clinic, if they've just had this motor vehicle accident, like let's say last week, they got the referral from the physician and are now coming in to see you. Usually they are very jacked up, and they have pain everywhere. So you try to do a little bit of movement with them, try to get things to kind of move a little bit. But then it's going to be for those types of patients, hey, how about some TENS units? How about some heat? How about some things to like calm down what the situation is? So there is a time where you might work treat a patient in that way for a little bit. MVA patients are a good example of that. But that's, as I mentioned just a minute ago, but that care is going to change over time. It's not going to be just those same modalities. Let's say you're doing traction on a patient, and that's all you're doing is just traction and traction and traction. There's a time and a place for traction. Don't get me wrong. It can be beneficial. But if that's all that's happening, That's not good therapy. If you're just receiving modalities, that's all feel good type stuff. There's a time and a place for that, but in general, for the vast majority of patients, if you're not a motor vehicle accident patient, you don't want to be receiving that for your physical therapy care. That would be bad physical therapy. And modalities are can help, and they can there's uh, can be some benefit at the end of the therapy session. So a lot of times you might work with a patient, understand that hey, you've worked with them, you've done manual therapy, maybe you've made them a little sore or something like that. So you might end the session by saying, hey, why don't we put some ice on that area that we worked now? Now that we've worked it and all that, let's see if we can't calm the nerves down. Let's try to calm that inflammation down, that we kind of stirred up. So that would be perfectly fine and acceptable. That's being done at the end of care. That therapist is wanting you to walk out of the clinic feeling better, and than when you came in. So, and they understand that hey, maybe that you stirred something up and it's needing to be calmed down. Um, that's fine. But if the primary treatment is just modalities, and that's happening every single time you come in, they're only putting you on heat. They're only doing TENS units. They're only doing ice. They're only doing um, ultrasounds or stuff like that. You're not getting good physical therapy. They're basically two things that therapists have. They're two uh, toolboxes that we can use to significantly improve your situation. One of those is exercise, and the other of those is manual therapy. So you've got to have some of that incorporated in. Otherwise, you would consider it just to be bad physical therapy. So, so this is going on much longer than I expected. So I'm gonna wrap this up. Thank you for tuning in today. I hope that this has educated you a little bit and helped you to understand when you might be receiving bad physical therapy. If you didn't see the video that I did before this, which is what is good physical therapy, then check that out. That out is the video just before this one, and it kind of goes through some specific 10 points. Actually, I thought of 12 on there that it would exemplify what is considered good physical therapy. Anyway, thank you for tuning in. If this was beneficial for you, then we ask that you press the like button and help us to kind of grow this video series. But do be on the lookout for our next series. And I may continue this. Actually, I do have an idea for doing what is like some ultimate bad physical therapy. So I may actually do that as the next series. But I hope to catch you then. All right. Y'all have a good one. Bye.